As you know, Dr. Al Shands was the first chief in in the early 30s, and I didn't know him personally, but I know he was a great educator, academician, and very much interested in research.
Dr. Shands was the first orthopedic surgeon. He was invited to come when the program started in 1930. So Dr. Shands grew up in Washington, D.C., went to UVA as an undergrad, went to Hopkins and trained with Dr. Baer, and then went into private practice in Washington, D.C., where his dad was the first orthopedic surgeon in Washington, D.C. at the turn of the century. So he'd been in practice 3 or 4 years when he was invited to come and be the chairman here at Duke. So he came, he was an associate professor, it was a division at the time, and his first resident was a fellow by the name of Bev Rainey. Dr. Rainey went on to become the first chairman of the Department of Orthopedic Surgery at the University of North Carolina in Chapel Hill in the 50s. While here, he had a textbook, the Shands Handbook of Orthopedic Surgery, and that textbook was continued to be published by Dr. Rainey for years and was the probably primary text for medical students around the country. Dr. Shands was invited to become the director of the DuPont Children's Hospital in Wilmington, Delaware, so he left in 1937 to do that job, and Lennox Baker was invited to become the next chairman of the division of orthopedic surgery at the time.
Of course, very familiar with Dr. Baker and Dr. Gollner, since I trained 50% under one and 50% under the other. They're certainly two different personalities, but both taught us in different ways. Dr. Baker was a stern taskmaster, a disciplinarian who taught us to keep our white coats immaculate, our shoes polished, and made us better ladies and gentlemen, and thus better physicians. He had this incredible talent or personality of developing relationships with not only people in medicine, but in the government or political world.
Dr. Baker's big contribution, he was very interested in crippled children. He developed a crippled children's hospital here that now has his name, the Lennox Baker Children's Hospital. He developed the first PT program in the country here, physical therapy. In addition, at the end of World War II, they weren't sure what they were going to do with all the physicians that had been in the war, and so they divided the country up into districts, and the district for this area was North and South Carolina. So Dr. Baker, with a grant from the National Infantile Paralysis Program, worked with Oscar Miller to set up the combined orthopedic program for this region. And it included the Charlotte Memorial Hospital, it included Gastonia, the Miller Clinic, the Shriners Hospital, Warm Springs, Georgia, as well as Duke and the VA. So it was a big expansion for our program and really organized and structured the program in terms of residents rotating through various places to get their training. So it was a big addition.
And when he did step down from his position as chief of orthopedic surgery, he was appointed the first secretary of the state human health and resources. So he had many connections. Now, Dr. Gollner was a different type of teacher. In fact, as I've said many times, Dr. Gollner was the best teacher I've ever known throughout my academic training and career. Not only did he teach us, but he also, we learned about hands-on with the patient, a great physical exam, care and compassion. He certainly was a model for the patient first wants to know how much you care before they care how much you know. Dr. Gollner really exemplified this.
Dr. Gollner went on when Dr. Baker stepped down to become chairman here. He's Best known as a tremendous educator, sort of the Socratic method, had great dedication to the residents, and expanded the program to 8 residents a year. He was an innovator in terms of hand surgery as well as clubfoot surgery. He also was very involved with spine surgery, popularizing the anterior lumbar interbody fusion.
Dr. Goldner was a great leader and was often drafted into positions where he never formally ran. He was president of the North Carolina Orthopaedic Association, the Eastern Orthopaedic Association, the Southern Orthopaedic Association, the Hand Society, the Southern Medical Association, the Foot and Ankle Society, the American Orthopaedic Association, and the Association of Cerebral Palsy. It should be noted that Dr. Goldner is the only orthopedic surgeon in history to be both the president of the Hand Society and the Foot and Ankle Society. When we think of Jim Urbaniak, we think of his favorite expression, which is "Give it a go." Give it a go is unique to West Virginia, but what it means is giving your best. And if we were to describe in biographical terms Dr. Jim Urbaniak, throughout his career, he has always given his best, and he has inspired so many of us to give it our best.
Jim Urbaniak was the consummate leader of Duke Orthopaedics in his tenure as chief of the Division of Orthopedic Surgery. When Jim took over the department in 1987, it was a relatively small department. I believe, if memory serves me correct, that there were no more than 9 or 10 faculty members. One of the great accomplishments that Jim made that dramatically changed the face of orthopedic surgery was his program in microsurgery. Jim started this program in the 70s, but when he became the chairman of the orthopedic department, he carried this program to international recognition. By that I mean he was recognized as the consummate orthopedic microvascular surgeon in the world. This translated into a lot of interest in others around the world becoming microsurgeons and emulating what Jim had started at Duke. And because of this, we developed a program where many international orthopedic surgeons came and spent 1 to 2 years working with Jim in the lab and clinically to establish their microsurgical expertise. This blossomed around the world so that we've had fellows in multiple countries that have been able to carry on this great tradition.
So then I followed after these 3, and where does that put me? It was difficult because I couldn't mimic all of their special traits they had. But I remember Dr. Baker called me the night I was chosen to be chief of orthopedic surgery here, and he said, "Boy, Duke Orthopaedics is ranked number 12 right now. You got to get us higher than that." So that wasn't my main goal, but I kept that in mind, and I had 3 or 4 objectives. One, which was to increase our grades on the in-training exam, since we were kind of in the middle, so I kind of modified our academic program some, and we did rise to near the top. I also felt like we needed to have at least 2 clinicians in every subspecialty of orthopedics. And this we did accomplish, and many of these went on to become internationally respected and leaders in their particular subspecialty. The third thing I wanted to do was increase research, and we've been very successful in that area and became one of the leading NIH recipients for orthopedic research from our basic sciences laboratory. And I guess the fourth thing, I did want to carry on this strong legacy we have and not forget these people that had taught us. But also I felt it was important, everybody's working hard here, to have a good camaraderie, an atmosphere where people enjoyed being part of the orthopedic program and working at Duke. And I think that we were successful in this area. So we did become a success. I will say of all these first 4 leaders we had here at Duke, all of them were president of the American Orthopaedic Association. which is probably unique to our program. So after my tenure was over, Dr. Nunley came in, and he's done an amazing job of changing us from a division to a department, and credit goes to Jim for that.
Dr. Nunley trained here as a hand surgeon and started his career as a hand surgeon, but partially through his career decided to refocus on foot and ankle. Became one of the premier foot and ankle surgeons in the world. He's been the past president of the Foot and Ankle Association. Has really helped develop total ankle as a option for treatment. His focus was to take Duke Orthopaedics from a division to a department, and was instrumental in that. Dr. Nunley's skills are really to be able to focus on a problem and see it to fruition, and he was able to do that. So I think without his efforts, we would still be a division.
I had the good fortune to have Danny Jacobs as the chairman of surgery. And in his previous role at Creighton University, orthopedics had become a department. So Danny allowed me the freedom to develop a program that would let orthopedics become a department. What that program meant was that we had to be recognized nationally as leaders in research. We had to be fiscally responsible so that we could manage our own assets, and we had to have the administrative structure to allow us to succeed. So I was happy to say that over the course of time, working with Danny, we were able to show the Duke administration that we'd accomplished those goals. The administration allowed us 1 year to prove that we could be a department, and then after that, the university declared us a department, and I felt like that was one of my major goals. The other major goal I had was to establish a program in which any patient who wanted to be seen by Duke Orthopaedics could be seen. This was different from in the past, where we were a small department and didn't feel like our role was to take care of the mundane problems. So based on this, we worked very hard to establish a community program. And that community program meant that I personally went and spent a day a week in Roxborough, North Carolina, then Smithfield, North Carolina, then at the federal prison in Butner, and developed relationships that allowed us to put a community practice into these various areas, which then allowed Duke Orthopaedics to expand its influence so that any patient desiring to be seen by a Duke Orthopaedic surgeon was able to do that. The third thing that I was very happy about was establishing our presence off campus, that is not on the Duke, physically on the Duke campus. We were able to find a building that allowed us to create a clinic structure where we could be physically separated, and this allowed us a greater opportunity to see patients because it was much more convenient for patients. And this turned out to be a very, very good thing. Patients loved this, physicians loved this, and it was beneficial to the entire health system.
It's hard to make improvements to a department as strong as Duke Orthopaedic Surgery. The incredibly bright state of our department is based on a strong foundation built by our past leaders and the many contributions from our exceptional faculty. We are charting the course for the future of orthopedics by generating and using new knowledge to improve health worldwide, building on the principles that our past chiefs established. Our vision is to be the global leader of today and develop the leaders of tomorrow in orthopedics and rehabilitation, research, education, and patient care. And to achieve this goal, our missions are to move forward, to put our patients and their families at the center of all we do, to provide the highest quality care as we increase the breadth and quality of what we provide, to step up, to serve and to lead our local and global communities, to reach out, to promote and to develop excellence in education, and to climb higher, to inspire through innovations in basic scientific, clinical, and translational research that will significantly improve health outcomes. All of these are missions that were embraced by our past chiefs. I'd like to invite you to join me in celebrating our rich heritage and in participating in our even brighter future.